My name's Caleb Shork, and this semester I worked with Docstation for my project. So just to give some background on Docstation, so Docstation is a cloud-based platform that allows pharmacists to document care with patients, to carry out a lot of the clinical services we see in the community. And really what they're working on now and getting their business up to date on is medical billing in the community pharmacy. So this vision really resonated with me. Whenever Sam came and presented to the class, I knew this was the company I really wanted to work with. I have a unique background in the insurance world. I've worked in a chain community pharmacy. I did my IPI at a really innovative independent pharmacy that did a lot with medical billing. And then I've worked in a hospital and then also done some Medicare counseling on the side. So I'm really well versed in insurance. And I'm interested to see the ways that we can leverage that into creating better services for patients and pharmacists. So again, I wanted to see community practice transformed going forward. That's something I'm passionate about. And a lot of us in this course are also in the community leadership and innovation and practice area of concentration. We took a class this summer about implementation science and implementation research, and I really felt like that's the problem that was to be solved working on this project. And like I said, I came up with this 3-word problem statement. That's a lot of what we worked on in this course, is developing those statements. And I felt that the problem that was being had with Docstation was implementation and growth. So how do we start implementing medical billing in the community pharmacist workday? Community pharmacists are always busy. It seems like week after week, new things are piled on: COVID testing, COVID shots, now the boosters, it's flu season. There's a lot of jobs to be done by community pharmacists. So how do we motivate them to buy into using Docstation in their workflow when they're already busy? How do we get them to see that value? And then how do we grow the idea and make it available in all community pharmacies? So there are some states, depending on where you are, where we can bill directly for services or provider status, and there's some states without that. So how do we make it available to everyone, or as many pharmacists as possible, so that we really launch this off the ground and get it working in as many places as we can? So with that going forward, I started with a literature dive. I really needed to learn more about medical billing, even though I felt like I had a good grasp on it. I found a few studies about how medical billing is being utilized in different areas of medical practice. So I used that to kind of get an idea of how I wanted to start implementing Docstation into the community pharmacy workflow. And then with that, I thought about a rapid prototype, which we talked about a lot in this course as well. Before I had the chance to meet with some of the Docstation leaders, I watched some online interviews that Sam, the CEO and founder of Docstation, did. And then he does weekly updates. So I read those on the website, which helped me get an idea of where we're at. And then after that, I met with the team, Dorothy and Max. It helped me to see a demo of the Docstation platform. I learned, what they're working with, the sorts of data insights that they have, and really the great services that they have ready to go and to utilize into the medical billing sphere. So with that, it allowed me to create some of the things that I utilize going forward throughout the semester. So like I said, show, don't tell. So I started with a simple, rapid prototype, and I discussed this in class. I had a lot of ideas, but I really needed to get it down into something tangible. So I ended up making my own 9-minute prototype of what I thought about. So like I said, I looked into some more medical billing opportunities. I considered a lot of the clinical services that a community pharmacist can do, things like PHQ-9, blood pressure screenings, diabetes care. I implemented all of those sort of ideas into my prototype video that I made, shared that in class to my peers, and got a lot of feedback on how we could utilize that and leverage it going forward, which was really helpful. And it was a good exercise in just getting the medical billing opportunities down and then seeing how we could possibly use it in a community pharmacy workflow. And then after that, I created a bio persona, which is another thing that we talked about in the course. So with this, I really wanted to think about who our users were going to be with Docstation, what sort of pharmacists would be using it, and then what problem are they trying to solve by actually taking part in the Docstation mission, and then how they work towards solving the problem. So with that, I felt like a good way, and the team thought it was really important to look at what others are doing. There's a lot of different companies that are working on similar projects. But with that, there's always room to learn and improve our own process, which is what I took away from working on that project. Using that, move forward to refine our product and making it the best out there that pharmacists really want to use. So I worked on the competitive product analysis, which is a project that Dorothy, Max, and I kind of worked on. And by sharing that, we got some insights onto some of the key differentiators between Docstation and a lot of the other medical billing platforms, e-care plans, those sorts of software that are out there. Use that to go forward and improve what we already have. So like I said, I made this buyer persona. So I thought about a lot of the pharmacists that are going to want to use this are the younger generation of pharmacists, probably in independent practice, that really want to utilize those clinical skills we learn in pharmacy school, really motivated to make money, but also taking care of patients. So by taking care of patients, we're keeping them out of the hospital, out of urgent cares, and keeping them healthy, motivated to continue those services so that they keep coming back to the pharmacy, and we're keeping a close eye on them. Pharmacists are really accessible healthcare providers. So that was really my idea for this buyer persona. I think those are the sorts of pharmacists we would reach. And then this is the competitive analysis project that I worked on. So this is the whole complete thing. We took a spreadsheet. We took about 25 or so different companies that are already working on these sorts of platforms. And then we filled in just all the information that was out there. So took some key differentiators, some strengths, some weaknesses, and just some general notes about what others are doing, and got some great ideas of how I think we can improve the product going forward. So with all that in mind, we can use the competitive analysis project and use those key differentiators between Docstation and a lot of other companies to make our product better. So a lot of things that I saw and that I am interested in is that a lot of the other programs use more patient-facing software, which I talked a lot about with Max, and about the ways that there are opportunities to engage the patient in their own care. So I think that's something I would be interested in seeing going forward. I think that's a good possibility. And then from there, I think we can create a list of pharmacies that fit the buyer persona that I said. A lot of these independents that are interested in clinical services and contracts that they can make money for medical billing, use that to expand out, pitch our idea, and hopefully get others to buy in. And then a big thing is the value-based care. So really getting that value out of caring for patients, going the extra mile, doing these sorts of clinical services. So really emphasize that to our partners that are going to buy into Docstation. And as I talked about before, we want to expand this to as many places as possible. So it's really important to fight for things like provider status in states like Pennsylvania that don't have it, so that this sort of medical billing platform can be as accessible as possible. And even without provider status, look into ways that pharmacists can sign on to contracts to provide clinical services, like I have done in my independent practice that I worked at. And then also make sure we hear the feedback from our current users that are working with Docstation, continue to improve as we go forward. That's always important. And then with this, we're always going to be working towards implementation, getting it going in all these pharmacies, and always continue to grow as much as possible. So with that, I want to thank Sam, Dorothy, and Max for all their great help and advice over the semester. It was a great time working, and really interested to see where Docstation will go very soon. Thanks.
Thank you, Caleb. And for our audience here joining again in the chat will be the link to provide feedback. And I believe I saw in attendance Drs. Andrig and Dorothy, Dr. Patel as well. And I'll certainly turn to them for their questions and comments, but recognize the great work of Caleb taking this on as an individual student as we are going through with groups and building on some great work. I have to share with Sam Andrig, the weekly updates that you provide through Docstation really highlight so much of what this course looks to accomplish, and sharing a story, showing, not just telling what comes through. So thank you to Dr. Andrig as well as Drs. Lee and Borkowski for sharing so much of your journey. And Caleb, I think you're able to really build on that with what you presented here today. I'll pause. Dr. Zandrick, Patel, comments or questions for Caleb?
I'll say really good job, Caleb. I think the problem that we gave you is a huge one, right? And it's multifaceted. It was really great to see you walk through the exercise of trying to figure out you're trying to answer some of the same questions that we are. It's a multifaceted, it's a question, but there's a million questions underneath it, right? And so with the prototype, like you starting from scratch and figuring out, okay, how does this look in my mind based on what I know, is something that we did at the beginning and we continue to do all the time, iteration and figuring out, what sort of value can we drive for pharmacies. It's a never ending kind of exercise. What was really interesting is like the competitive analysis that you did too. We actually are talking to, pharmacy leaders in a specific state right now, and they're getting so many questions from their pharmacies about all the different solutions out there. So they're actually planning to put together a competitive analysis and outline all of the different strengths and weaknesses to help pharmacies kind of choose the best option for them. So that's a data point that was really interesting. And the implementation side is it's not there's no recipe, right? And so I think it's about spending as much time with pharmacies that are using the software and getting information from them. What are going back to the persona that you built too, right? Like, who's the person that we're trying to talk to and get in touch with? But also what aspects about their pharmacy make them a great fit for Docstation, or how can we help pharmacies that are high utilizers kind of implement some of this stuff, whether it's a residency program, having a resident on staff, taking students, putting a technician into place. So just providing a little bit more color there. I thought you did a really great job.
Thank you, Dr. Andrew. Dr. Patel?
Hey, Caleb. Yeah, I also wanted to echo what Sam had said. I thought you did a really good job. The competitive analysis, I think, was, really challenging. As we talked about, it's kind of hard to find that information just off of the websites for some of those companies, but I think you did a really good job digging in and finding that information that can be difficult at times just on the surface to find. So good job with that. And then I'll also say, right now, we are definitely struggling to find out all that information that's out there that deals with medical billing in the different states. Because as you touched on, all the states have different legislation and it's changing rapidly as we're progressing. So good job on doing that research and capturing that information.
Thank you again, Dr. Patel, for participating and providing such helpful feedback and guidance. And to Caleb, before we round out, any last comments and questions from our audience and then turn to our team from Cosmos Health. Caleb, I wanted to ask, one of those challenges when it comes to working with new ideas is balancing what you had to, a landscape, and then the human component of it. What does somebody see or touch or feel as you're trying to go through this process of creating a pharmacy service that can be billed for? Can you tell us about some of the challenges or some of those connections you made between doing something like a rapid prototype and having to look at a very large question like competitive analysis or what medical billing would look like? How did you connect those two very far ends of the spectrum, really large concepts and really tangible takeaways?
I think, again, it goes back to a lot of the experience that I've had. I had different, like one of the companies that we researched in the competitive analysis was Prescribe Wellness, which is the platform I was using in my P2 IPI to document COPD and asthma, CMRs, TMRs, things like that. So with that kind of idea in mind and the things that I liked when I was using that, I took that and kind of added it into the rapid prototype I was making and thought about the opportunities that pharmacists have in the medical billing world, and then again connect that back to looking at what some of the competitors are doing. And it was pretty difficult because some of the competitors are not necessarily pharmacy only. They're working with huge integrated health systems like Epic and Cerner, or there's ones working with solely with physician practices. So taking some of those ideas from each area kind of helped me connect all the dots there.
Excellent. And like I said, it's a challenge that's facing many industries, many companies, many ideas. And if anyone solves it, they're going to make the world a better place and probably a lot of money at the same time. So the fact that you're taking those steps towards doing so with pharmacy settings is really exciting. Again, thank you for sharing your work and your great efforts on this project. Any last questions or comments from the audience before we turn to our team from Cosmos Health? Great.